Understanding a baby's sleep and hunger cues can help parents better respond to their baby's needs and establish healthy routines. Here's a detailed guide. Sleep cues in babies. Babies often show signs of tiredness before becoming overtired. Recognizing these cues early can help parents settle them to sleep more easily. Early sleep cues: decreased activity, reduced engagement or slower movements, yawning. One of the earliest and most recognizable signs, rubbing eyes or face. Babies may use their hands to rub their eyes, ears, or face, looking away, turning their head or avoiding eye contact to reduce stimulation. Subtle fussiness, becoming slightly irritable or unsettled. Late sleep cues, crying. Persistent crying may indicate the baby is overtired. Clenched fists, a sign of heightened tension and tiredness. Jerky movements. Uncoordinated or sudden movements may occur. Red eyebrows or face, flushed cheeks or reddish eyebrows can signal fatigue. Tips to respond to sleep cues. Start a calming bedtime routine, e.g., swaddling, rocking, or singing. When early cues appear, create a conducive sleep environment with dim lighting and reduced noise. Place the baby down when drowsy but awake to encourage self-soothing. Hunger cues in babies. Recognizing hunger cues ensures timely feeding, which helps prevent crying and makes feeding a smoother experience. Early hunger cues. Rooting reflex. Turning their head toward a touch on their cheek, looking for food. Sucking movements. Lip smacking or sucking on their fists or fingers. Opening. Mouth. Wide open mouth or sticking out their tongue. Restlessness. Moving their head side to side or wriggling. Active hunger cues. Increased movement. Becoming more active or squirmy. Vocalizations. Small cooing or fussing sounds. Hand-to-mouth movements. Bringing hands to their mouth repeatedly. Late hunger cues. Crying. A late sign of hunger. The baby may need to be soothed before feeding. Frustration or arching back. Increased agitation or arching movements. Tips to respond to hunger cues. Feed your baby when early signs appear to avoid distress. Observe patterns in feeding times to anticipate hunger. Practice responsive feeding by offering the feed as demanded. Key points to remember. Every baby is unique. Learning your baby's specific cues takes time. Responding promptly to cues fosters trust and security. Over time, you'll notice patterns that make it easier to meet their needs proactively. If you're ever unsure about your baby's cues or behaviors, consult with your pediatrician for guidance.